Maternal health is very important because losing mothers due to childbirth will automatically damage your home, because some of these women have 2 or more children. So losing them in the birth of the 4th or the 3rd is very sad for the rest of the children at home. And for us in Sierra Leone, women are the backbones in the homes. So losing a woman means that family is crushing or will be crushed.
I think actually in Sierra Leone specifically, but I think that's also the case for more West African countries, maternal health and public health are like completely intertwined, because I actually think that maternal health is a lot to do with prevention.
Okay, in the broader public context, first looking at it globally, what's the burden of HIV? Globally, I think it's about 400 million people are living with HIV, okay? And then when you look at it, where is the burden now? The burden of HIV is in about 70% of people live with HIV are in Africa, okay? So the burden is big, okay? Then apart from that big burden, what is the what? What is its impact on the individuals? Okay? So HIV is also one of the drivers of increased mortality. Either in reproductive health where I work, it can also be a driver of increased morbidity and mortality. The risk of HIV in pregnant women tends to be high, especially in low resource settings like in Africa, and where health services access is so compromised, and also it tends to be influenced by educational background, knowledge about HIV, how it's transmitted. So those are the factors which can fuel the risk of HIV. Knowledge about HIV, how it is spread, how you can prevent it. If it is low, then the risk of HIV can be high. The other risk is most people have not tested also, so they don't know their status. Not knowing your status can expose you to risk because you don't take preventive care. You don't even because you are not aware of your status, you continue to spread the infection in the community.
Yeah, so HIV is definitely a problem in sub-Saharan Africa, and it's an especially big problem in the community that I work in Uganda as well. And what we're finding is that women, especially young women, like older teenagers, women in their 20s, even their younger 30s, they are getting HIV at a rate that is much higher than their proportion in the population. And in fact, they're the largest at-risk group, or really the largest demographic group that's most likely to acquire HIV. And so, this has a lot of ramifications for different aspects of women's health. Of course, people that have HIV are immunocompromised often if they're not taking the antiretroviral therapies consistently. So they are likely to get a host of other opportunistic infections, including things like tuberculosis or even malaria. And of course, there is a lot of implications for pregnant moms in terms of potentially passing on that HIV, to their child.
People, especially in this northern part of the country, I heard that the HIV rate is increasing because a lot of people are coming in for mining, and then they infect these young girls. They don't know that they should go for testing and all this stuff. So if somebody is pregnant and the person is unaware that they have HIV, I think it's a problem. But it is good now that the government is pushing that every PHU, for the first time a pregnant woman comes, you need to do the HIV test. So I think that's kind of like reducing it a bit, but it's still a problem because for the girls that are not pregnant, they don't want to come to the hospital, or probably they don't know that they should come to the hospital for checkups. So they will not know, and they will continue to live with the HIV unknowingly, and it's killing them slowly.
So I think actually the HIV care is already like way better because there's been such a focus on already in the country. So in every PHU, in every hospital, people are very aware of like, you should test for HIV. And I think it actually goes really well that if women come to the clinic, like all the women are tested for HIV. I think the problem is more that sometimes we have like difficulty convincing women to come early for the antenatal visits. And then they are already quite far in the pregnancy, and then we only diagnose them with HIV, and then before we have started them on their medication, it's quite late, and that increases the risk of transmission to the baby. But also, if the mother already has like an end-stage disease of HIV, of course the risks are super big, because then probably she will have tuberculosis as well, she will have other opportunistic infections, she will have like general poor health, severe anemia maybe, and all of those things make the pregnancy more dangerous for her, but also the fetus development is just less. But I think the testing actually goes really good, and if they're testing positive, I think they also start quite quickly with the TLD. So not all the medications are allowed in pregnancy, but I think the good news is that the standard TLD medication that we actually always give to patients is safe in pregnancy, and they carry like very small risk, but they completely, like the benefits completely outweigh the risk, because if you have an active HIV infection, like the fact that you're sick as a mother is already a danger, and then I think there's such a high risk of transmission either in the delivery or in the breastfeeding period if you are not on TLD. Yeah, and then your kid will have lifelong HIV to deal with. So I think for the standard TLD medication, you don't have to worry about it. And also the drink we give to children when they're born from an HIV positive mother, we give for 6 weeks, is also been tested and completely safe for the child. Yeah.
Previously, the knowledge was very limited. Now, I think due to awareness raising, advocacy, free medication, I think people are becoming more aware of the importance for them to seek help, to know the status, to go to the hospital and get tested. But there's a whole lot of stigma around that. So that is stopping people really from going into these institutions, into the hospitals to get tested, because also there's a problem here in Sierra Leone on what we call confidentiality. Yeah, because people say if I go there, then the nurse or whoever it is going to scandalize me to the community. And we have several cases that it has happened, and unfortunately there are no consequences for that. And that medication, you see the result, there's a positive result, and you continue with your medication as long as confidentiality is there and you are willing to take your medication. Because that was the fear that people are saying they're going to be stigmatized if they're seen going to the HIV unit and getting medication and not being honest with themselves, you know, because for the fact that they will be stigmatized. And before we used to see it as a death sentence, but now it's slowly getting better.